Should you be having morning erections, and how often should they happen? I'm Dr. Laura, a urologist and pelvic surgeon. I recently shared a short clip from when I was a guest on the Ever Forward podcast, and it's been getting a lot of attention, so I thought it would be a good idea to explain it more. First of all, why do men wake up with an erection? It's not just because of sexual dreams or thoughts. Morning erections are a natural part of how the male body works. They're called nocturnal penile tumors and usually happen during a certain part of sleep known as REM sleep, the stage where dreams are most common. REM sleep usually takes place in the early morning hours, which is why men often wake up with an erection after sleeping or during this stage. Many of you probably remember waking up as teenagers with your blanket raised by morning wood. But what's considered normal as you get older? This has actually been researched for many years. One of the first studies was done in 1975. In that study, 125 healthy males between the ages of 3 and 79 were brought into a sleep lab. They were connected to machines that measured brain activity, eye movements, and changes in penis size while they slept. Each person spent 3 nights in the lab, and the middle night's data was used for the best results. Only people who had no sleep issues, no erection problems, and weren't taking any medicine that could affect the results were included. From this, researchers were able to gather normal data from healthy people, meaning they didn't have any underlying problems. Starting in early childhood, ages 3 to 9, sleep-related erections begin and stay pretty steady. As you move into the teen years, this is the high point. Erections during sleep are most frequent and last the longest. During this time, the average erection during AV sleep lasts about 40 minutes. That means about 40% of the night is spent having erections. After puberty, this percentage slowly drops and becomes steady at around 20% of total sleep time, which is about 1.5 hours each night, with each erection lasting around 30 minutes. Most people will have between 3 to 5 erections during sleep each night. Now, you may ask if REM sleep drops with age, but it actually doesn't. REM sleep usually stays the same after your teenage years, with most adults getting around 100 minutes of it each night. A newer study looked at how erections during sleep change with age, using a special device to measure them. This study included 40 healthy, sexually active men between 20 and 60 years old. None of them had issues with sex, sleep, or took medications that could affect performance. They spent a night in a hospital where the device recorded their erections. Even in this newer study, they found that men in every age group still had nighttime erections. The difference was that blood flow to the penis was less. Men in their 20s had a 268% increase in blood flow, while those around 50 had about 200%. So while the flow was slightly less, it was still healthy. The number of erections and how long they lasted didn't change much. The average was a little under 4 erections per night, 3.78, and the longest one lasted around 31 minutes. Other studies over the years have confirmed these same results in healthy men. So what does all of this mean? It means you should still be having nighttime or morning erections well into older age. Of course, they're strongest and most frequent in your teenage years, but they do slowly become less frequent over time. However, if you notice that you almost never wake up with an erection or don't feel them at night, it's something to think about. That's because regular erections during sleep show that your blood flow is good, your hormones are in balance, and your nerves are working properly. All things that help erections happen. If that's not happening, something might be off. You might even begin to notice weaker erections during sex or other signs like low testosterone. So I suggest that if you see these changes, start by getting your testosterone checked. There's a strong link between nighttime erections and testosterone. Sometimes, when testosterone drops, one of the first signs is a loss of nighttime erections. It's also important to look at your lifestyle and make sure your health is on track. That includes keeping a healthy weight, staying active, doing both strength training and cardio exercises each week to boost blood flow and hormone health. Also, try to lower your stress and get good sleep. All of these things support better blood flow and sexual health. The bottom line, morning erections are a sign of how healthy your body is. They are like a signal from your body telling you if everything is working well. If you see changes, it's a good time to check in and see what you can improve. It can even help you catch issues like erectile dysfunction before they start. Think of it as your body giving you a helpful warning. If you're enjoying this kind of content, you might really like my newsletter. Every week, there's a section for men's and women's urology where I share new research for both. I also answer one question from a subscriber and let you know what's going on with me. If that sounds good, sign up. It's totally free. And as always, take care of yourself because you truly deserve it.